In this podcast episode, Dr. Ayesha Sherzai and Dr. Dean Sherzai, board-certified neurologists specializing in Alzheimer's disease, dementia, and cognitive decline, delve into the crucial topic of brain health. They discuss how dementia is not just a late-life diagnosis, but a gradual process beginning decades earlier. The conversation covers the science of brain aging, cognitive decline, and actionable lifestyle habits that can reduce the risk of dementia by over 50%. They emphasize the importance of proactive brain care starting early in life, and especially spotlight 5 foundational habits essential for preserving and even improving cognitive function. The doctors clarify that dementia is an umbrella term describing cognitive decline severe enough to interfere with daily life. Alzheimer's disease represents the most common type, accounting for 60 to 70% of dementia cases. Other forms include vascular dementia, frontotemporal dementia, Parkinson's dementia, and Lewy body dementia. Dementia develops as a result of accumulated brain damage involving amyloid beta plaques and tau protein tangles, inflammatory and vascular changes that silently start 20 or more years before symptoms appear. This cumulative damage often goes unnoticed because the brain has a remarkable ability to compensate early on, masking underlying pathology until significant decline occurs. Dr. Ayesha highlights that brain health exists on a continuum and damage begins early, often in 20s or 30s. Mild cognitive impairment, MCI, a stage between normal aging and dementia, manifests with noticeable memory and focus difficulties, but with preserved independence. Unlike normal forgetfulness, MCI symptoms are persistent and interfere with activities. Early identification and intervention at this stage are crucial, as lifestyle and medical strategies can slow, halt, or even reverse some aspects of cognitive decline. The neurologists see patients with cognitive concerns increasingly younger, underscoring the need for community outreach and brain health education long before dementia develops. The brain's plasticity, the capacity to form new connections between neurons throughout life, is a central theme. Although neuron loss is difficult to reverse, synaptic connections can grow and multiply, strengthening brain function even in old age or after injury. The Sherzais use visuals to explain how lifestyle choices influence the number of connections between brain cells. Negative habits and stress can sever these links, shrinking brain networks, while positive habits promote abundant connections that build resilience and cognitive reserve. This reserve acts like a savings account. The more deposits a person makes through healthy living, the more protection their brain has against damage and age-related decline. Chronic stress is singled out as one of the most harmful factors to brain health. Elevated cortisol and prolonged fight-or-flight states cause structural brain changes, including loss of volume in the hippocampus, the region critical for memory encoding. Stress also impairs sleep, weakens the immune system, and promotes unhealthy behaviors such as poor diet and inactivity. Caregivers who endure prolonged stress while often neglecting their own health face a dramatically increased risk of cognitive decline, up to 600% greater than the general population. Shared environment and lifestyle within families also contribute to risk, making caregiver self-care paramount to prevent brain shrinkage. To simplify prevention, the Sherzais introduce 5 core lifestyle pillars under the acronym NEURO: nutrition, exercise, unwind, restorative sleep, and optimize cognitive activity. These pillars reflect evidence-based strategies shown to significantly reduce dementia risk, slow progression, and promote brain growth. Good brain nutrition is about consistent dietary patterns rather than superfoods. Emphasizing a plant-rich Mediterranean or Mind diet, they recommend leafy greens, cruciferous vegetables, nuts, seeds, legumes, whole grains, berries, coffee, tea, and anti-inflammatory spices. These foods combat inflammation, oxidative stress, glucose dysregulation, and lipid abnormalities, all key contributors to brain damage. Just adding 1 serving of leafy greens daily has been linked to brains 11 years younger on imaging. Proper nutrition can reduce Alzheimer's risk by 53%, showcasing the brain's remarkable responsiveness to what we eat. Physical activity, particularly aerobic movement and strength training, is vital. Legs act as a powerful pump for cerebral blood flow, delivering oxygen and growth factors like BDNF that stimulate brain and blood vessel growth. Simple activities such as brisk walking for 25 minutes 5 times a week can reduce Alzheimer's risk by 40%. Strength exercises focusing on leg muscles have shown a 47% reduction in cognitive decline progression in a twin study. Exercise also improves emotional health by combating anxiety and depression, reinforcing its multifaceted role in brain preservation. Reducing harmful stress is essential since chronic activation of fight-or-flight biology damages nearly every system, including the brain. The Sherzais encourage identifying and minimizing bad stressors while enhancing good stress driven by purposeful activity. Structured approaches like making lists of stressors and joys increase awareness and help regain control. Purpose-driven good stress provides cognitive stimulation and emotional resilience, whereas unmanaged stress accelerates cognitive decline. Unwinding techniques should be intentional and personalized. Sleep is the brain's nightly housekeeper and memory organizer. During deep restorative sleep, the glymphatic system clears toxic proteins, including amyloid beta and tau, from the brain, preventing accumulation associated with Alzheimer's. Sleep also consolidates memories, filing daytime information into long-term storage. Chronic sleep disturbances, apnea, or fragmented rest disrupt these processes and raise dementia risk. Consistent wake-up times, exposure to natural light in the morning, a cool and dark sleep environment, and cognitive behavioral therapy for insomnia are recommended to improve sleep quality. The brain thrives on complexity, purpose, and challenge. Lifelong learning, social engagement, creative activities, and meaningful tasks stimulate neural pathways and enhance cognitive reserve. Research from the NUN study showed that individuals with rich linguistic ability and intellectual complexity maintained cognitive function despite significant Alzheimer's pathology. Engaging in multifaceted activities like learning a musical instrument, dancing, reading with active processing, or combining mental tasks with physical movement, e.g., walking while listening to educational podcasts, maximizes brain growth and resilience well into old age. Dr. Ayesha and Dean Sherzai emphasize that brain health is largely within individual control, irrespective of age. Even in the presence of early cognitive impairment, adopting these lifestyle pillars can slow decline and improve quality of life. The brain's plasticity offers the opportunity to repair and grow with consistent care. Importantly, these changes not only benefit individuals, but also their families and communities by shifting shared risk factors. The neurologists encourage starting small with manageable steps and reinforce that every healthy choice is a building block in the lifelong cathedral of brain health.